Good morning guys, my today's topic is gangrene. Gangrene is a disease where the person body area will become dry and so hard even the small force will break the limb at the particular part. So let's start with the introduction of gangrene. Gangrene is a serious medical condition where the loss of blood supply causes body tissue to die. So basically in the gangrene, the blood supply will stop and due to that stopping of blood supply, the body tissue where present at the affected area will become dead. So it often affects the extremities such as toes, finger, feet, hands, but also can occur in muscles and internal organs. So in the person body part, these are the common parts where the gangrene become affected, like the toes, finger, feet, and hands. And in the rare chance that muscles and internal organs get affected by the gangrene. Gangrene is typically caused by infection, trauma, or chronic diseases like diabetes or peripheral artery. So, in the person who has gangrene is typically caused to the person by the infection, trauma, or chronic diseases like the diabetes and peripheral artery. So now you can see the types of gangrene. There are basically 5 types of gangrene. The first one is the dry gangrene, which is commonly caused due to the lack of blood flow without infection. Means we can also say that the ischemia means the blood flow becomes stopped, but the infection will not occur. That type of gangrene is called as the dry gangrene. So it commonly occurs in the people with atherosclerosis, diabetes, or severe peripheral artery diseases. So these are the people which is commonly affected by the dry gangrene, which also appears in dry skin and severe skin. Means the hole will become created in between the skin. These are and now you can see the pain in the dry gangrene. The initial painful means the starting phase of dry gangrene is so painful, so severe, but it also become numb and the nerves become dead. So the body area where the gangrene will affect the patient at that particular body area, the nerve become dead. So it's spread like the dry gangrene is the slow progression disease. Means the progression or spreading of the disease, particular disease, to the one body area to the another body area is so slow. In except of wet gangrene. The wet gangrene is this is a picture of dry gangrene where you can see the roughness of the skin and the holes of the skin will present. Now you can see the second type, which is the wet gangrene, which is commonly caused due to the sudden loss of blood supply with as well as bacterial infection. As we can see in the dry gangrene that the blood flow will stop, but the infection will not occur. But in wet gangrene, the blood flow will also stop and the bacterial infection will also occur. So these both, due to these both conditions, the person will suffer from the wet gangrene, which is commonly occurs in the commonly occur by traumatic injuries, burns, or festivals, which will get infected. So this appearance is like in the swollen, blistered, and moist tissue. So the person who will suffer from the wet gangrene, they get the swollen at the particular body area where the wet gangrene will present in the particular body area. So the pain in the wet gangrene is so severe and sudden. Like as I said in the dry gangrene, that the starting phase of the dry gangrene is so painful, but in the wet gangrene, the whole from starting to the end, the whole wet gangrene is so severe and sudden. Now, as I say that in the dry gangrene, it is the slow progression. The progression, like the spreading of the dry gangrene, is so slow, but the wet gangrene is completely opposite to the dry gangrene. Means it will spread so fast, so rapidly. If it not get treated, the person may also get dead. This is the picture of wet gangrene where you can see that in the thumb of the leg, the wet gangrene will occur, and due to that, if the patient will not get treated, the whole limb also get amputated, and even if it is not treated yet, then person may also die. This is the picture of wet gangrene which occurs in the hand. This one is occurs in leg, and this one is for hand. So now you can see the third type of gangrene, which is gas gangrene, which is caused in infection by Clostridium species, especially Clostridium perfringens, commonly in deep and contaminated wood like the if the person has open wound, then the gas gangrene, chances of gas gangrene will so high that person get infected by that. The appearance is like pale to brownish red skin. The person's skin body area will become brownish and red at the particular area where the gas gangrene will occur, and also the gas bubble type will form, like as we see in the inflammation or swelling, the body area where the swelling or that infection will occur, the body area will so become large. So same like that, the gas will form in that particular body area. The symptoms of the gas gangrene is sudden onset of severe pain, means the person suddenly get the severe pain at the particular body area. Rapid swelling will occur at the body area, and the sign of systemic toxicity, means the fever, stroke, this will occur in the symptoms. In the urgency, like medical emergency, we have to also in emergency case of gas gangrene, we also suggest directly to the surgery, or we can give the antibiotics for the pain relief. This is the picture of gas gangrene, where we can see the whole area will become so big because of the gas. Now you can see the fourth type, which is the internal gangrene, which is caused by the blood flow blockage to internal organs. As I said, starting introduction, that highly rare chances that person get infected in the muscles or internal organs. So this is the one case where the internal organ become affected by the gangrene, which is common in hernia patient, volvulus, which is also called as twisting of the ball, and the mesenteric artery occlusion. This is the commonly disease where the internal gangrene will occur. The symptoms of the internal gangrene is severe abdominal pain, fever, nausea, vomiting, and the sign of sepsis if untreated. Sepsis is basically a bacterial infection which occurs in the blood. If it's not get treated or the internal gangrene, the chances of sepsis become so high, and the other symptoms is like fever, nausea, and vomiting. The diagnosis is the CT scan and ultrasound. By these machines, we can also diagnose if the internal gangrene is present or not. In the urgency, we can directly suggest patient to go for the surgery to treat the internal gangrene. This is the picture for the internal gangrene, where you can see the body area will become so rough and by the internal side, and this is the part where you can see in between the two fingers of the leg, internal gangrene will occur. The fifth and final one is the hernia gangrene, which is the subtype of wet gangrene. This is the type of wet gangrene which is affected the genital, perineal, and genital perineal regions. Means in the genital area of the male and female, the hernia gangrene will occur, which is caused by the mixed bacterial infection, often in immunocompromised individual. Means the person who is infected by the several type of bacteria, they may will highly chances that they will affect from the hernia gangrene. This gangrene will commonly occur in diabetic or hypertensive patient following trauma or surgery in the Gangrene area. The symptoms of the hernia gangrene is the pain, swelling, fever, and rapid spreading of necrosis. Necrosis is the one type of disease which, if the hernia gangrene is not treated, then the high chances of that the necrosis will also spread. The treatment for the hernia gangrene is the aggressive debridement. Now you can see the signs and symptoms of gangrene, which will for the hernia gangrene, the change in skin color like the blue, purple, or black, cold and numb area. These are the symptoms where from the gangrene will for the hernia gangrene. The diagnosis is the physical exam. We can see physically that the person will affected from the hernia gangrene. The treatment is the surgery antibiotics for infection, hyperbaric oxygen therapy for gas gangrene, and this is the treatment. The prevention is manage diabetes or vascular diseases. Our prompt treatment of wound or infection. This is the prevention for the all gangrene. This is the picture of the corneal gangrene where we can see the genital area of the male. The person gets infected by that. Thank you. This is the my time for gangrene. Thank you.